Hi everybody, welcome back to another installment in the Nico the Vet Show. Today I thought we might take a look at a curious case we had not so long ago at the practice that I work in. It's a case of a kitten with nasopharyngeal polyps. So I thought we might just go to the very first slide to try to demonstrate what we mean. So what do we mean by kitten nasopharyngeal polyps? Well, to state the obvious, kittens. The reason it's called the kitten is in there is because it's a condition usually seen in younger cats, usually less than a year, and usually significantly less than a year. So very much kittens rather than young adults or adults. And polyp at the end of the term, polyp means a growth, like a tumor, but a benign growth rather than a cancerous growth. So what's the difference between a benign growth and a cancerous growth? Well, benign growths are, for example, that would be like a wart on your finger, and it's benign in the sense that you've got a growth. Yes, it's a tumor, so it's a big lump of abnormal tissue, but it's not going to spread to the rest of the body. So it's a nuisance where it is, but it's not a risk to your general health because it's not going to spread. As opposed to a malignant lump, more commonly referred to as a cancer. An example of that would be if I were unfortunate enough to develop prostate cancer. So yes, I develop a lump of abnormal tissue in my prostate, but that's not what's going to kill me. What's going to kill me is that the cancer will spread from my prostate to the rest of my body and destroy the other organs and tissues in my body. So nasopharyngeal polyps are the equivalent, not equivalent, but analogous to warts in the sense that they are non-cancerous lumps. And then the nasopharyngeal bit, naso means nose, pharynx means throat, so the back of the cat's throat, which you can see here. So these polyps develop in the very, very back of the throat, just behind and above your soft palate. So if we orientate ourselves on this photograph, this is a very young kitten. Obviously there's the nose with the nostrils, here's the front teeth and the fangs, there's the hard palate going down, and then there's the edge of the soft palate that you can see there. This is the ET tube, so the endotracheal tube, which is giving this cat oxygen and anesthesia to keep them anesthetized while we do the procedure. And obviously there is the tongue and the lips on the side, and these are my great big clumsy fingers. So run your tongue down your soft palate from just behind your front teeth, and if you run your tongue down your hard palate, you'll feel eventually as you get to the very bottom or the very back, your hard palate becomes your soft palate, and you can push that membrane upwards with the point of your tongue. So when these cats develop these polyps, they usually develop after an episode of a respiratory virus, typically what we colloquially call cat flu. So the herpes virus and the calicium viruses will cause sort of a snotty, snuffly cat for a while, then they'll appear to recover from that, and then they become snotty and snuffly again. And because what's happened there is the irritation to the soft tissues that's been caused by the virus causes a proliferation of that tissue, and effectively it grows into a lump. They generally arise from the middle ear. So remember, your ear canal is divided into the external ear, which is everything from the outside into the eardrum, and then just on the other side of the eardrum is the middle ear. So the growths or the swelling, the irritation that leads to the growth develops usually in the middle ear, and then it has to go somewhere. So it can either go outwards, which would force it to penetrate and puncture through your eardrum, or most commonly the growth grows inwards, which is into the back of the throat via the eustachian tube. So the eustachian tube, we've all got one running down from the back of our throat to our ear, and that's what you do on an airplane when you hold your nose at blow and you pop your ears, you're forcing air through the eustachian tubes. So when these inflammatory polyps arise from the middle ear, there's not a lot of space there coming up the eustachian tube. So they generally progress as a long, thin stalk, and then once they reach the nasopharynx, the back of the throat above the soft palate, there's space for them to expand, and then they grow into a lump. So this photograph, the first in the slide, shows we're using an instrument here. This is, again, the hard palate. This is the soft palate, and we've hooked behind the soft palate here, which usually would lie there, so you wouldn't see the polyp, and we're slightly drawing it forwards there a little bit. You can just start to see the polyp emerging over there. So on the next slide, you see we've pulled the soft palate even further forwards, and you can see even more of the polyp appearing there. Putting it even more, so a little bit stage by stage, even more soft palate forward, and it's becoming apparent that this is a substantially big polyp in the back of the nasopharynx. And once we have it pulled as far as we possibly can, we expose the extent of the nasopharyngeal polyp. And in fact, it's even worse than it seems, because this is one of the polyps. Because you've got, again, to state the obvious, 2 ears, you can potentially have 2 nasopharyngeal polyps arising at the same time. So this cat, in fact, had this massive one here, and then another massive one right behind it. The treatment of these is rather elementary. We literally use a big forceps, grab hold of this lump, and then we slowly pull it outwards, so literally out of the mouth towards ourselves in this direction. And again, think of it as a big growth on a long, thin stalk. And as we pull slowly, 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 the stalk will stretch, stretch, stretch until it snaps. And once we've got the first one out, we go and we pull the second one out. So the next slide is rather hideous. It looks like the poor kitten is deceased on this. She's not at all. The reason her pupils are fixed and dilated and open is not because she's dead. It's because we gave her methadone and medetomidine as a pre-medication before her anesthesia. And here you can see the extent of the polyps. That's the one that we saw when we were putting the palette forward. And we literally just saw this part. If I zoom in a little bit onto the next slide, so we can see here, for example, is one of the polyps. This is the smaller one of the two, and there's its long, narrow stalk, which was setting off. And in fact, the other one was even bigger. And this demonstrates also the scale. I mean, if you have a look at this little kitten's face, this is obviously the mouth, this is the nose here. The space here, this is the nasal space here, has to accommodate 2 lumps of this size, which is quite ridiculous. And so the presenting symptom with these poor creatures is that it causes an obstruction in every sense. It causes an obstruction to breathing, because air's going in through the nostril and can't go down the windpipe or the trachea at the back. And also, massive lump in the back of the throat. You can't eat and drink comfortably. So these kittens will often be snorty and snuffly and battling for breath, and trouble sleeping even because of severe obstruction to the airway when everything relaxes, and their lives are just thoroughly, thoroughly miserable. And a simple procedure like pulling these out will alleviate the problem immediately. So here's a rather ghastly picture of myself pulling a ridiculous face for reasons I don't entirely recall. And here's my wonderful colleague, Carolyn, who performed the procedure with me. And like I say, once you've pulled these lumps out, effectively you have cured 99% of these cats. Yes, it may recur, it may regrow, and to try to reduce that happening, we would use some antibiotic and some anti-inflammatory to bring down swelling and irritation in the middle ear where the whole problem arose. And 99% of the time, that will solve the problem. You've transformed the cat's life, and wow, what a massive result for a very, very simple procedure. So if you have a snorty, snuffly cat and they seem thoroughly distressed and uncomfortable by the condition, please take them down to your vet who will have a look. And if it comes down to this sort of procedure, please take the opportunity to make a big difference. Thank you, keep well, and I'll present another presentation, pretty much case of the week sort of thing, when another one comes along. Thank you, bye-bye.